Hey vlog, today is Saturday, August 27th, and I have just been called into work for an emergency case. So I thought I'd vlog it and take you along with me and show you as much as I can of a day going in to see a call case. So I gotta get ready, put the dogs out, and then head to work. Alright. Hey buddy, you wanna go outside? You wanna go outside? Come on. Rose, you wanna go outside? You wanna go outside? Let's go. Let's go.
Living life, every day, late at night, not okay. All I want, and I pray, all I need are some better days. Fuck me, I'm looking in the mirror, so foggy, but I've never seen clearer. I don't really think anyone can save me, and honestly I'm not really sure I want saving. I like to be my own worst enemy. There's no risk if you don't try at anything, so I'ma just keep buying everything. See you in the next life, have to be a better me. I don't think that my head's on straight, gotta flip it and grip it and go and get an x-ray. What's wrong with me? I just feel weight pushing on my chest and it squeezes till I suffocate. Better change my mindset, meditate. It's pretty cool that I'm alive and have better days. I could walk, see, hear, I should celebrate. Think I could change my mind, maybe elevate. Living life, every day, late at night, not okay. All I want, and I pray, all I need are some better days. Yeah, all I need are some better days. Cause all I want, and I pray, I believe in the better days. I'm kinda stuck between a rock and a hard place. Do I work hard or live at my pace? You're only young once, yeah that's all great, but I also want a future where I'm okay. Living life is doing lots of cocaine. Wait no, it's living with no shame. Wait no, it's sleeping in on Sundays. I guess it's different for each of us and that's okay.
I had plenty of time to go through my routine and stuff, and then work just called me and said, we need you to get here now. So we're on the way. It just started raining, so I just grabbed a rain jacket and got my stuff, said bye to Hunter, and got out the door. All I know about this case so far is it's with one of the doctors who does cornea procedures, and they said they ordered in a donor tissue, which should be here around like 4:30, and I don't know what happened. I've been called in, I think this is my third like emergency call case. The first two, okay, the first one was crazy. This poor patient had, I guess was doing construction work, and then he used a hammer, and the hammer hit something and then ricocheted, and you know how the end of the hammer is like those two prongs that stick out? Yeah, that went into his eye. That went into his eye. So all the surgeon did there was closed it up so it couldn't become infected, and then that was all they could do. The second case, which oddly enough was just last Saturday, it was an older patient, and they don't know exactly like what happened. He just went to bed with his eye red and like slightly irritated, and then apparently by the end of the day when he woke up, his eye was like cloudy and the cornea was really thick and it looked infected. So his family rushed the patient in, and again all they could do was close up the cornea, because when stuff happens, like some trauma happens like that, that could be it. That could be it for your eye. That's why we have people come in to get like enucleations to take out their eye. It's usually because something happened to the cornea, it got infected, and then it became painful, so they have to take the whole eyeball out, which is insane. But hopefully this is not the case here. That's why they do the emergency cases, obviously, to try to prevent stuff like that from happening. But yeah, all I know so far is they ordered in a donor tissue from some lab, and I think it's being like FedExed here. So by the time I get there, the patient will be there, the tissue will be on the way. It'll be my job to set up the OR and have everything I could possibly need in there. Then I'll go out and help another nurse pre-op the patient. I'll do the case, then I'll go out and help with discharge, and that should be it. I'm hoping it's not going to be a general anesthesia case, because those are a little tricky, and the discharge time for that is over an hour. So I'm kind of hoping that's not gonna be a thing, but we will see. Sorry, it's starting to rain and it's gonna be way harder to hear me. So I will just see you at work and update you there. Bye. Okay, so this is our locker room. This is where they keep all of our scrubs. We keep our work shoes in here. Here's my locker, our cute little mirror. The outfit's atrocious, I know. And some posters from the company we work for. And this is our IOL room. These are the replacement lenses when people have cataracts. Here we are 4 hours later, I think. So I walked in there and the case immediately turned like complex. Instead of having just one surgeon come in to work the case, it turned into a combo case. So our retina surgeon and a cornea surgeon both came in to work on this patient's eye. At the actual procedure, I guess this person had like a corneal transplant in the past and had some incident with it. So today we had a donor tissue come in, and it was very large, about the size of a whole cornea. So the cornea doctor sutured that in place. Then, hang on. Okay, so the cornea doctor went first, put on the new cornea tissue, sutured it in place. Then the retina surgeon went in afterwards. He had to drain the choroidal fluid from the anterior chamber of the eye. I don't know, I'm not great on eye anatomy, but that's what he did. Then the cornea doctor came back in again and then sutured the paracentesis in the eye. And I know I'm probably speaking French right now, but anyway, that's the actual procedure. And as we left, they said that that guy's eye was saved, and if they weren't able to do surgery today, then wouldn't have been too good. So that's awesome. And okay, what's kind of nice about like weekend call cases is that time that we're clocked in is added on to the rest of our week. So I think I was at 38 hours coming in today for the week, and this was another, what did I say, 4? So then that's 42, so then it's overtime, then it's, you get paid for coming in, then it ran really late, so you get paid extra for that. So, and let me tell you, planning a wedding is so friggin' expensive, so worth it, but so expensive, so that'll really help. But yeah, that's about what a call case consists of. This one was a lot more complicated than the previous 2 I've been at, but it was still doable, and we all worked together as a team really well. And the patient went home healthy and the surgeons were happy, so you know, that's all that matters. I'm just gonna close up the vlog here, so thank you so much for watching, and I'll see you next time.